Hello everyone, welcome back to my YouTube channel, and today is going to be our first lecture here. Okay, I am Dr. Dada. So what are we going to be discussing today? We are going to be discussing coronavirus. Okay, coronavirus. I know almost everybody in the world heard about coronavirus within this year, from late last year to this year up until now. So up to now, research is going on, but there are some things that have been found out, so I'm going to present it to you today. So in general, when we say coronavirus means what? The large family of the viruses. It means like the father of the viruses. When we say coronavirus, it doesn't mean we are talking about the disease. We are talking about the family of those viruses. So coronavirus is the father, or it's the mother of COVID-19, while COVID-19 is one of the children of coronavirus. So now we are going to talk small about the coronavirus, and then we move into the COVID-19, because we are going to focus mainly on COVID-19 today. So coronavirus is a group of viruses, infectious viruses, that are usually causes respiratory diseases. And these viruses, we have of two types. There are those that originated from the animals, and there are those that originated from the human beings. And usually those that originated from the human beings are usually very rare to cause severe disease, while the animal ones are very, very dangerous, so they cause severe diseases, even that. Okay, so and usually in the animals, it's usually found in, they are known as beta virus because they are usually found in birds. Okay, so now this coronavirus is it has mainly three types in the animal form. So the human form causes diseases like cold and rest, and then the animal form causes diseases like COVID-19, the one that's going on now. So we are mainly going to be focusing on the animal form today. So we have three types in the animal form. Let me show you the names of these three types. Yeah, before we go, this is coronavirus in general. Here's our coronavirus laughing at us, and we are going to talk about definition, types like I just did, and transmission. Okay, the transmission of this coronavirus is mainly through droplets, and also there are fomites and feces. So research is going on, so many things are being discovered. Before, it was thought to be transferred only through droplets, but now there are researchers that said it can also be discovered through, can be also transmitted through feces, fomites too. So fecal oral. Okay, and after this, we are going to be talking on the COVID-19 definition, origin, transmission, incubation period, clinical picture, risk of exposure, risk of severity, complications, diagnosis, treatment, and prevention. So now, this COVID-19 is a large is a virus which causes upper, lower, and even extra respiratory tracts abnormalities. So this virus, like I said, the origin originated from animals, and the animal type of coronavirus, we have mainly three. Like I said, I will show you. Let's use this paper to see. We have the MERS-CoV, SARS CoV and SARS-CoV-2, and this is the one we are going to be focusing on. So these are the three main types of the animal coronavirus. This one means Middle East Respiratory Syndrome coronavirus, and this one means Severe Acute Respiratory Syndrome coronavirus. This one means Severe Acute Respiratory Syndrome coronavirus 2, which is the one that causes what? COVID-19, and we are focusing mainly on this type. We are focusing mainly on the COVID-19. Okay, let me keep this. So now we are going to be talking on what? Transmission. Like I said, the transmission is through droplets, fomites, and then feces. And the incubation period of this disease, is from 2 days to 14 days, 2 weeks, from 2 to 14 weeks. From 2 to 14 days. 2 to 14 days. Okay. Within this period, the virus prepare itself in order to attack the body, and when it finishes preparing itself to attack the body, that is when the symptoms of this disease will start appearing. So what are the symptoms of this disease? The symptoms are in 3 ways. The patient can be asymptomatic, and the patient can be symptomatic. And the patient, if the patient is symptomatic, it can be mild symptomatic or severe symptomatic. When the patient is asymptomatic, that means the patient is positive for this disease, but this patient cannot doesn't have any symptoms, but he can transfer this disease to other patients. You understand? So for example, I'm having this disease, but I'm not having any symptom. That is, I'm not coughing, I'm not having shortness of breath, I'm not doing anything, but I can transfer this disease to someone. Why? Because I have a good immunity, a very good immunity that is able to fight this virus and suppressing it to cause even the symptoms, while the other person that I transfer the disease to can either also be symptomatic or asymptomatic. It all depends on the immune system of this person. So now, the symptomatic type, if the symptoms are mild, that means the immune system also is good, but not as good as asymptomatic one. So we have mainly upper respiratory symptoms and constitutional symptoms. So there will be fever, and there will be cough, which is usually dry, but sometimes can be productive too. And there will be chills, muscle pain, and the person can also have sore throat. And if the disease is severe, if it has advanced, then the patient will start having symptoms of lower respiratory tract. So at that moment, the person will be having constitutional symptoms, upper respiratory tract symptoms, and then the lower respiratory tract symptoms, and even systemic symptoms if the thing is very severe. Okay. Also in the upper system, the patient can have problem with smelling things, and also problem with taste. And also if the person is touching his face anyhow, he can have conjunctivitis in his eyes. Okay, so this is the mild symptom. When the person is having severe symptoms, the person will start having shortness of breath, pneumonia even can occur, and then there will also be extra systemic symptoms. Okay, because this disease leads to generalized inflammatory reaction in the body, it will lead to what? If we know inflammation leads to what? Activation of coagulation cascade, coagulation pathway. So when this coagulation pathway is activated, what will happen? Definitely there will be formation of what? Thrombus. And thrombus likes traveling around. So when this thrombus is formed, it will come and be traveling anyhow in the body. If it goes to the brain, it will cause what? Stroke. Pew! The person will have stroke. If it goes to the lungs, it will cause pulmonary embolism. If it goes to the heart, it will cause arrhythmias. If it goes to the kidneys, it will cause kidney injury. You know, thrombus, wherever it goes, there will be problem. So now this is the complication. And so how does a person become at risk of infection, that is risk of exposure? Number one, we have the health cares, which include the nurses, the doctors, the medical lab, and the rest. And also we have the relatives of the patient, because they are in contact with the patient, so they are at risk of having this disease. And we have travelers too. Travelers, if you are in a place that is not having this disease and you go to a place that's having this disease, you are absolutely at risk of having this disease. And if you are in a place that is not is having this disease and you go to the area that is not having this disease, you are at risk of transmitting this disease in that area and spreading it to other people. And the last one is the community spread. Community spread is a situation whereby you become infected but you don't know how you become infected. Yani, you become infected but you don't know how you become infected. You don't know whether you've been in contact with the person that is infected, or you've been to somewhere, or anyhow, you just don't know how you become infected. This is community spread. Okay, these are the four main risks of exposure. The first one we have health workers, travelers, relatives of the patient, and lastly we have community exposure. Now, what is the risk of severity of this disease? I told you earlier that when your immune system is poor, you have the risk of having this disease, the severe form of this disease. And when you are more than 65 years or older too, you have the risk of having this disease. And if you have any other disease at any age, you can be 1 year old, or you can be 2 years old, you can be 10 years old, you can be 40 years, 50 years, but then you have a disease, a chronic illness, things like diabetes, hypertension, you are at risk of having this severe disease, severe form of COVID-19. Okay, now let's look at the diagnosis. The diagnosis of this disease, like I said, the cough is usually dry, but when it's productive, you can use the sputum and sputum culture. And then also you can do there is swab, throat swab, and then also you do imaging, which you can do the chest imaging, and then finally you can do blood test too. Okay, diagnosis is you can do imaging, chest imaging, you can do throat swab, and you can do, what did I say again? You can do throat swab, you can do sputum culture, and you can do blood tests. You can do also a coagulation profile. So, and the emergency, when does this case becomes an emergency? Whether or not you want it, you must take this person to the hospital. Number one, when the person can't breathe, it's having problem with breathing. And when the person is turning blue, like I am, I just start turning blue, so you must take this patient to the hospital. And when the person is having persistent severe persistent chest pain, you must take this person to the hospital too. And when the person is confused, so we have four emergency situation in this disease. Number one, it's bluish discoloration of the body, confusion, number two, and trouble breathing and chest pain, severe chest pain. There is no period of rest in this chest pain. So now, how can we prevent this disease? Number one is hygiene. Wash your hands regularly, and then cover your face, put on mask if you're going out, cover your nose and your mouth, and avoid touching your face anyhow, and also avoid large gathering, also avoid traveling with this disease, avoid coming in contact with people that are having this disease. Okay, now how can we treat this disease? Usually, up till now, there is no medication to this disease, but you do what symptomatic management. So you give painkillers to the patient, you give IV fluids, you also give oxygen, you give cough syrup to suppress the cough, and also you give mechanical ventilation if the thing is very, very severe. So you just manage the symptoms. Okay, and this brings us to the end of our lecture today, coronavirus, and I hope you get something out of today's lecture. Thank you. Kindly like, share, and subscribe. Bye bye, till we meet in our next lecture.